if you have a non-mosaic ring, we would expect that you would pass it on. If you have a mosaic ring, logic would tell you that you wouldn't pass it on because we think those mosaics happened after, well, I guess we don't know for sure. So if you have if the ring is in every cell, yes, you will pass it on. If the ring is if you are a mosaic, maybe. We just don't know. It will depend on if it got into your eggs for women or sperm for men. And we have been surprised that there have been some families, in fact, Dr. Canavini has reported one, where there are mosaic rings that get passed from generation to generation.
So this is very interesting because I've heard in the past that it wasn't familial and that it couldn't be passed on. So this is new information, isn't it? Or is it not?
Well, it's I don't know if it's new information or not. Most cases of ring 20, the deleted ones, have not been reported in the literature to have been passed on. But if you have one, once it happens to you, and then you have children, you should have a 50% chance of passing that along. And I'm not aware of any cases where that's happened, perhaps because people with ring 20 haven't had children, or I'm just not familiar with that literature. But it would be expected to have happened. But in most cases, you have a patient with ring 20 who's born to parents who do not have a ring 20. That's the most common that's been reported.
There are only two families in literature. One is mine, and one was reported like 30 years ago of a mother and the child, I think. I'm not sure if it was the mother, but just two families, as far as I know.
So for the families here, if they wanted to seek information regarding this, would you recommend genetic counselling and discussion of this?
I would always recommend genetic counseling. Yes.
Yes.
And then you can decide if there are other tests that are warranted at that time.
Mm-hmm.
Yeah.
Yeah. So we should not be afraid to go looking for that advice and for that counselling.
No.
Okay, great.